Hello, Namaste. I'm Dr. Amit. So, in the last two videos, we talked about autonomic receptors and acetylcholine receptor. Now, today we'll move forward and we'll talk about tissue distribution of adrenergic receptors, and we'll talk in details about alpha 1 and alpha 2 receptors. So let's start our videos. Today we'll talk about tissue distribution of adrenergic receptors. Okay, so we all know that adrenergic receptors is basically from sympathetic nervous system. Okay, so adrenergic receptors are activated by norepinephrine and epinephrine. So in our very first lectures, we talked about the sympathetic nervous system, in which there is preganglionic and postganglionic neurons. Okay, and these postganglionic neurons release norepinephrine, and they act on alpha 1 and alpha 2 or beta 1, beta 2, beta 3 receptors. Okay, so today we'll talk about these receptors. Okay, and today in this video we'll talk in details about alpha 1 and alpha 2 receptors. So the first thing is, in general, if we'll talk about adrenergic receptors, all adrenergic receptors are G protein coupled receptors. So this is very simple, as we have also talked yesterday, that G protein coupled receptors are nothing. These receptors have a G protein. So first the G protein get activated, and when the G protein get activated, then they releases second messenger, and those second messenger produces effect in those receptors. Now we'll talk in detail about alpha 1 receptors. Okay, so when norepinephrine or epinephrine is released, okay, so like in from this picture, okay, when norepinephrine or epinephrine release, then they will bind to alpha 1 receptors. Okay, so over here also same thing, norepinephrine, epinephrine bind to alpha 1 receptor. So as we all know that alpha 1 receptors are G protein coupled receptor, then GQ protein get activate, and they produces second messenger, and those second messenger can be IP3 or DAG, and that will produce effect that it increases intracellular calcium, and whenever there is increased intracellular calcium in any cell, then it will cause contractions, so it will cause the smooth muscle contraction. Okay, now let's understand clinically actually how alpha 1 receptor works. Okay, so in blood vessel there is vascular smooth muscles. Okay, so suppose this is our blood vessels. Okay, in blood vessel there is endothelium, and in the blood vessel there is also smooth muscles. So these smooth muscles contain alpha 1 receptors. Okay, so when the alpha 1 receptor of these blood vessels stimulate, okay, then it will cause smooth muscle contractions, and there will be vasoconstrictions of blood vessels, and it will increase the BP. So how it is helpful clinically? So there is a drug name called phenylephrine, which is alpha 1 agonist. So whenever there is any patient with hypotension, so when we give phenylephrine, then this phenylephrine will work on the alpha 1 receptor of these blood vessels, and it will helps to increase the BP of the patient. In the same thing, during cold or allergy, okay, there will be congestions of the nose of a patient. Okay, so because of vasodilations of the blood vessels of the nose, so what happened when we give nasal decongestions, those nasal decongestions also work on the blood vessels of the nose. Okay, and